Good morning, everyone. Thank you, Patrick. I have the privilege of helping to kick off the Mobile Innovation Summit, and both of those terms are very near and dear to me. So innovation has been a topic that I've been studying ever since MIT. And initially we started talking about product or technology innovation, but really, I look at technology as an enabler. And today, we think about how mobile is kind of going mainstream much more rapidly than anyone has expected. So hence this conference, and glad to have the opportunity to both speak to you and also learn from you and hear about the programs that you're doing within your respective companies as well. So let me kick off by telling you a little bit about my background. I'm really coming at this topic from three primary areas: from the business side, the technology side, and also marketing. My most recent role was Chief Digital Officer of a group of agencies within the Omnicom holding company. We were focused exclusively on pharma companies. And so, as you can imagine, digital, social media, and mobile has been something that they've wanted to do, but they've been significantly behind other industries due to regulations or due to lack of regulations. So I'm going to start with the technology side of things, and today we're going to focus on mobile and how it is now a trend and it's so mainstream that it's enabling a lot of new things that simply have not been possible before. And I'll talk about some of the macro trends on the technology side. The next part would be the marketing and advertising. And the context of that is really getting a message out to, in this case, both physicians as well as patients, and how their changing habits and expectations are leading to changes in the way we have to do advertising and marketing. And finally, all of this has to come together to drive business impact. So, harkening back to my McKinsey days, if it's just great tech or if it's just great marketing and it can't map back to measurable business impact, it's no good. So today, Rob Peterson is going to kind of bookend the first day talking about ROI and how to measure it. So that's kind of the layout for today. And you've all seen this in the conference description. I highlighted a few of the key points. Hopefully I'll be able to touch upon all of these just very lightly in this first presentation, but the rest of the esteemed speakers will get into the details and present you with the actual examples from the field that we can all learn from. And let me just give you a quick agenda of this particular talk. We're going to start off with the macro trends, all the underlying technology trends that are driving these changes. And because of these enabling technologies, it's led to fundamental changes in user behavior. And we're going to get into both the patient's behavior and how physicians' habits and expectations have changed. And then I'm going to talk a little bit about, or give some examples of mobile technologies, some of which were even surprising to me. Hopefully I'm going to be showing you guys some new stuff. And finally, map that back to the new opportunities and potential impact for this particular industry, specifically pharma and healthcare. So with that, let's get started on the very first section. So a lot of this stuff will be obvious to you guys. We've kind of seen this evolution over the last 10 or 15 years or so. So the first would be internet adoption. So in a very short span of about 15 years, we've seen internet adoption go from practically zero to now the vast majority. So if you look at some of those numbers, even that's dated, from April of 2012, right? So about 80% use the internet. And the younger ages, if you look on the inset on the right-hand side, skew even higher in terms of internet adoption. The next would be smartphone ownership. So if you look at those two groups from 18 to 29 and 30 to 49, the adoption of mobile devices and smartphones in particular is also the vast majority. So even though the older ages are not quite into it, the people that we're marketing to right now all have smartphones. The use of social networks, that has also grown dramatically in a very short amount of time. I'm talking the last 3 to 5 years. And so, it's again the vast majority, 86% for the younger ages, 72%, for the mainstream ages. And in the light blue, you'll see that somewhere between 52 and 70% of them use social networks yesterday. So it's something that they use on a very, very regular basis as well. Now, not to say that this is necessarily used for professional purposes, but it's a change that's happening where they're getting more comfortable going online and interacting and sharing with other people. And so these are, again, pretty obvious. The top online activities are search, email, commerce, buying a product, and using social network. And the social network side of things, again, has just come out in a very recent number of years. And then we start talking about the devices that people use to access all of these things. So what you're going to see is that in the red and the blue at the bottom, that's computers and laptops. But in the recent 3 to 5 years, you'll see that smartphones and tablets have dramatically shot up to the point where now it's about 5x the number of devices compared to laptops and computers. So talk about being able to access information anywhere, right? You used to be tethered to your desktop computer. Then everyone got a laptop computer. And now with tablets and smartphones, it's 5 times, 6 times more prolific than that. So think about these as computing devices, because now smartphones are powerful enough to do almost everything that you need to do, on a desktop computer or a laptop. And paired with that would be mobile broadband, because if you had the device and you couldn't get access to the information because you didn't have enough bandwidth, it's not that useful. So now if you look at across all of these countries, the U.S. isn't even number 1, right? It's in the top 10, but you'll see that other countries have even further penetration in terms of mobile broadband. But again, this is connectivity across all of your devices, so you have access to the information. And all of that has now led to a change, a very fundamental change in how people consume information and where they access media. So this is from a Google study saying that about 90% of our media consumption now takes place via screens. And that includes all forms of screens, ranging from TV to laptop to tablet to smartphones. And that has led to dramatic changes, as you see on the bottom, radio, newspaper, and magazines. Okay. So all of this has led to changes in user behavior. And now let me show you some charts about industries that have been radically disrupted by these trends in technology. So let me start with a few obvious ones. Newspaper industry. We kind of all knew that, but just seeing that graph on how sharp that drop-off has been and how short a time frame that has been, it's pretty dramatic. And so it has also a real impact on the companies themselves. So if you look at some examples of their stock price since their peak in 2007, not even that long ago, you'll see that they're dramatically off their peak. The same thing's happening with the magazine industry. So as people are consuming news and magazine content online, it's decimating magazine companies. And again, we see the impact reflected in their stock prices. So what I'm trying to show you is that there are fundamental and very dramatic impacts to businesses that operate in these traditional industries. And the question is, how is that going to impact us in the pharma and healthcare industry? And that starts to beg for innovation and the fact that we have to act quickly and act robustly in terms of how we do our innovation. Because if not, if we don't, this is going to happen to us. And so some of the other industries, you'll see the music industry, as CD sales and physical CDs go down, we see a dramatic rise in digital downloads. That's that red spike. So as people get to choose what they like, they're going to do a lot more of it. Okay, so there's also a theme that's going to run through my talk and the rest of today and tomorrow, which is consumer empowerment or patient empowerment. They're going to be the ones going online to look for the information themselves. Same thing with the video rental industry. You'll see Blockbuster in the blue going down, and you'll see Netflix coming up. Now, there's a key point in this particular chart, and it's about efficiency. So if you think about Blockbuster, where they physically had to mail CDs, or you physically had to go into a store to pick up a CD, that was pretty inefficient, right? We're talking about moving physical products. Whereas with Netflix, you're just streaming it. So you don't actually even have to handle the DVDs, right? They used to, by mail, but now a lot of people are doing the streaming. So what I'm showing there is that a particular industry, like the video rental industry, can be replaced by a more efficient version of itself. So if you look at when Blockbuster was at its peak, it took $6 billion of revenue to make it a profitable or viable company. Now with Netflix, it takes only a third of that to be a viable company, because now it's operating at tremendously greater efficiencies when you're now just streaming and you don't have to move physical product. So that's another theme that's going to run throughout this conference as well, is achieving greater efficiency in processes by the use of technology. And here we're talking primarily mobile technology, smartphones and tablets. And we'll have examples coming up in a little bit. Same thing's happening with the film industry, right? So Kodak, it's gone the way of the dinosaur, because people have fundamentally changed to taking pictures on their smartphones and being able to share it. They don't do it by using film anymore. And also the retail industry. So all of these are kind of obvious examples of industries that have been completely disrupted by technology trends. And what's underlying that is really the irreversible changes in consumer habits. And I'm going to start to talk about both the consumer, i.e. the patient, as well as the physicians. So users now have evolved to a point where they are the ones pulling for the information themselves when they want it. They're typically bombarded with enormous quantities of ad messages or advertising marketing that we all do. But now they're very good at now picking out the information themselves when they want it. So they're going to be the ones pulling for the information. And then they're getting more savvy at it. If you look at these eye tracking studies from Google, you'll see that in 2005, they looked all the way down the first page of Google search results. But by 2008, 2009, they don't look past the first half of the first page of Google search results. So it's both that they are very impatient, right? They're going to go refine their search right away, or they're getting more savvy, right? If they type in a short phrase or keyword and that doesn't give them what they want, they're going to now go immediately type a longer phrase that's more descriptive and more detailed. So they're getting more impatient and they're getting more savvy. And you'll see that that trend continues to hold in mobile, right? When you're on a mobile device, you're not going to be tolerant of having to click through to a website only to find out that's not what you're looking for, right? You want the answer right now. So the mobile consumption habits are that it's kind of propagating that being very impatient to get the answer right away. And then the other key theme is their expectations are changing. So now these are screenshots of BlackBerries. And you'll notice the J&J website, which has since been fixed, but at the time I took the screenshot, it was all made of Flash. The whole front page was made of Flash. So it doesn't show up on a BlackBerry, and it won't show up on an iPhone or iPad either. So in this case, the key takeaway here is that if these users are trying to look up their information, look up your information, and they happen to be using a mobile device like a BlackBerry, and they can't get to your information, or even if they can get to your information, like the two examples on the right-hand side, but they can't use it or navigate it using the device they happen to be using at the time, it's useless for them. Okay, so again, knowing and understanding how people access sites is going to have a cascade of implications for what you need to do. So I think some of the recent numbers that I've seen are between 10 to 30% of sites traffic now comes from mobile, and that includes both smartphones and tablets, with iPad being a very dominant device that they use. And the other thing that's happening is that there's all this study. This is taken from a consumer side study from Forrester, where they trust their peers, friends and family for advice, and they trust ads the least. So they trust their peers the most, and they trust ads the least. And there's a similar theme in terms of physicians, where they're looking to their colleagues to give them advice and give them tips on what to look for. Okay, so that theme's going to carry through. So now that people have these devices in their hands, it's also led to a complete shift of power. So this is just an example from the consumer space where a consumer has a smartphone and they're standing in the Best Buy, right? So a salesperson is trying to sell them on that HDTV, but now they can look up that information and say, well, I can get this at a much better price online or elsewhere, and the reviews of that particular HDTV aren't even that good, right? So because they have constant and instant access to information, the power has now entirely shifted into the hands of the consumer. So again, that's a theme that you'll hear throughout, where patients are now empowering themselves by going online to look for information, to study up about the disease or to read up about the particular drug that either they are being prescribed or their family members being prescribed. Okay, so that's how the shift of power is happening. So the next couple of slides, I'm going to talk about some physician characteristics. So physicians are also very, very digital. So if you look at the percentage online, it's practically 100%, right? And also they consider the internet and digital to be essential to their practices. Okay, they're mostly small business owners, and so they're going to be using internet and information to help make their practices more efficient. They also use smartphones, and again, this corroborates the data that we saw before, where the younger ages over-index on the use of smartphones. 3-device ownership. This is even common now. So in addition to the desktop, they also have a smartphone, and they also have a tablet, and they have all of them, and they can use that interchangeably. So again, how is that going to impact the way we either do marketing to them or the way we engage physicians and HCPs? And then talking about their mobile use. So I'll have this deck to share after the conference, so you can look at some of this data in more detail. But just look at some of the things that I've circled at the top. Looking up drug and treatment reference, clinical research, and things like that. And also their app use. So the top two have to do with their practice. And then the bottom one is really reading up on journals and medical information. So in addition to going online to look for that, now they're using apps that are published by New England Journal of Medicine and other sources as well. And then they also over-index on a lot of other things. So for example, in terms of communicating with patients online and using Google. So when I first started at Omnicom, there was a general consensus, physicians just go straight to PubMed, or they go straight to New England Journal of Medicine. But actually, they start with Google. They actually go straight to Google first, because now in one place, they can search for what they are looking for, and Google will direct them to any of those sources, because they index all of those sources, right? So in fact, they're going to start with Google rather than one of each source by itself. So that's also going to be changing in terms of how pharma companies have to think about first reaching the physicians, meaning they have to really think about search engine optimization for content on their own websites. And then this other point is that about 1/3 of physicians now say they don't ever see a pharma sales rep. So we've kind of seen that happening, and a lot of my clients have been tremendously downsizing their sales rep part of it, their sales force, even though the MSL side of it hasn't been downsized as much. But again, a lot of physicians are now turning online to look up that information themselves rather than have someone come pitch to them. Okay? So again, all of these are fundamental changes that I think are irreversible, and that's going to have a significant impact on the way we do advertising marketing. So now let's take a closer look at mobile technology. So we've talked about this stuff, which is laptops, tablets, and smartphones. And as you can see, compared to the total U.S. population and then the total online population, now between tablets and smartphones, it's the vast majority. So most of those people have those devices and are using those devices to get online. But beyond the typical smartphone and tablet, now let's look at some other technologies. So Google Glass, it's shipping already. So it's another user interface, it's another wearable technology that people are starting to use to get access to information in virtually real time. And basically, they have this on all the time. It's not like they even have to pull out a smartphone to look at it. It's just on. And then there's all these other devices that are now starting to make their way into the mainstream. So these are the fitness trackers that we've all heard about. And here's some other stuff that I found. So breathalyzer that now syncs with your iPhone via Bluetooth, so it can upload or record the results. Eye scan. This is pretty interesting to me, using the high-res screen on the smartphone and using the high-res camera plus the flash to actually do diagnoses in remote regions. Okay. Blood glucose can be measured and then plugged directly into the iPhone for either upload or recording. and also a way to identify pills and adverse interactions. So all of these might be experimental, like this, might still need a lot of vetting to make it work really well. But these are things that are coming. So even though they may not be extremely mainstream today, these kind of give us a preview of what's to come. Now let me go a little bit broader and talk about non-mobile type things that are still going to be a part of this entire ecosystem. So let's think about these on-skin sensors that are going to be able to sync with mobile devices via Bluetooth, for example. And they can detect all sorts of different vital signs and body functions, things like biological functions. The next would be in-ear speakers. So again, as we miniaturize devices, we can actually have these either implantable or somewhere wearable on the body. So these can get small enough that they can be put into your ears. On-eye projector. The visual is not exactly correct, because that's the one from Google Glass. But the concept of that is that it's projecting an image directly into your eyeball. So you maybe you've seen the TV show Continuum. They have contact lenses that do exactly that. They project right into your eye so you can see it, and it's on all the time. So given that, with these kind of devices, obviously you can't plug them into a wall to recharge them. We now have nano batteries that can be recharged very quickly and wirelessly. So they hold a very large amount of charge, and they can also be recharged very quickly. And then we pair that with things like wireless charging technology that's coming out of MIT right now. So again, all these devices, especially the really tiny ones or the implantable ones, now can be recharged wirelessly. So what I'm showing you are just some of these technologies, emerging technologies that will all start to come together to enable an entirely new generation of mobile, well beyond just the smartphone and tablet concepts that we're talking about right now. Okay. And so because of that, we're looking at, in the very current state, a lot of people starting to use apps. So this chart shows you the different kinds of apps, so there's a large variety of them. And some of the initial apps have to do with fitness and cardio and tracking your pulse and things like that. But again, that's going to evolve over time, and we're going to see a proliferation of the things that people can do with apps and with these devices. And then the next wave will be wearables. So anything from Google Glass to the smartwatches that are coming out that can also pair with those fitness trackers, like Fitbit and things like that to track your health. Okay. And all of that's going to lead to what's now being called pervasive monitoring. So these are things that the consumer themselves want to do, right? They want to measure themselves. You heard the term quantified self. Those are things that are going to help them live healthier lives, live better lives. So all of these devices are helping them do things that they were just not able to do before. And so all of this, Patrick was mentioning some of the stats about how mobile health is going to be growing tremendously. So let me show you a few charts to back that up. So in terms of medical data, so this is the blue line is physicians and the red line would be the patients. We're starting to talk about data points like weight, vital signs, calories, exercise tracking, and activities. And all of those things are things that people want to track. Fitness and wellness tracking will tend to grow fastest because that's the easiest to do right now. So in terms of compound annual growth, we expect these kinds of apps and services to be growing faster than other categories. But that's not to say that those other categories that are enabled by some of the technologies that we just talked about are going to grow much faster as well. And beyond smartphones, we talked about smartwatches, medical devices, headsets, things like that. Okay, so all of these other wearable devices are also going to be growing relatively quickly. And the fact is, we're still at the very, very beginning. So on the chart on the left, half of the people still say, they're not that interested in, these kind of mobile health applications. Half of them are. And then on the inset, they're not yet willing to pay for it. So they're going to experiment with free stuff right now. But so that's what tells me that this is still right at the beginning of the trend, and there's still enormous opportunity to come. And then, so these are some of the projections, 3 different projections, one very aggressive, one middle of the road, and then one that's more conservative. But all of them are pointing up and to the right. Okay, so everyone's expecting this to be a huge, huge growth area. And so the key themes are that patients are going to take control. So not only is it control over the information that they're looking up, so say for example, they're looking up the drug that they're being prescribed, or they're looking up the drug that their family member is being prescribed. They now have the opportunity to not only empower themselves, but also inform themselves about all of these products. So the typical, I guess, the conventional wisdom that, if we're selling an oncology drug, we typically don't communicate with the patients. We just sell it to the physicians or the hospitals. That also has to change, right? The patients themselves are going to be the most knowledgeable about the oncology drug that their family members being prescribed, right? So all of that's changing. So again, the shift of power to the consumer is going to be a consistent theme. And then physicians are also going to use technology and mobile to help streamline their practices and try to use it to increase the efficiency of their practices. So again, I'll have these slides with all the sources cited later, so you can look into some more of these details later. And then finally, some regulatory considerations. So in terms of digital marketing, we've kind of been held back by the lack of clarity from the FDA on what pharma companies are allowed to do or not allowed to do. But in this case, there's already been some initial guidance, which is that they intend to regulate apps under the definition of a regulated device. And similarly, that includes apps that emulate functions of existing devices as well. Okay. So that being said, those should not necessarily hold back the speed of adoption, the rate of adoption of not only the devices themselves, but the apps as well. So now let me get to the very last part of this talk, which is to introduce some concepts of impacts and new opportunities for pharma. So the first would be, if you think about people coming online, not only online, but now on their smartphones and devices, they're looking up information. And as they're typing in search terms to look for information, we now can track it. So, basically all those actions are generating huge quantities of data, i.e. big data, that we can now analyze for insights. So what I'm showing you here are basically some Google Trends or Google Insights, where we're comparing pairs of words. So in a very simplistic example, you see anti-cancer versus anti-tumor. Anti-cancer has 6 times the search volume as the word anti-tumor. So by looking at this data, which is generated by the hundreds of thousands or millions of people that are using search, now we can start to optimize words within the content that we're writing. Okay? So this was something that we deployed at the agency. We were primarily a scientific communications agency with a lot of medical writers. Now instead of guessing which word to use, or instead of writing a word that sounds better, we now can have a kind of a scientific methodology to study what words physicians search for, what words patients search for, because they're now doing this online and via their mobile devices. So you see all these other examples. The Pew, for example, more people search on the misspelling than on the correct spelling. And then you'll notice on anti-hemophilic, most people are too lazy to type in the dash, right? So it's just anti-hemophilic. That's the way people search. So again, this should give us insights about how people search and what they search for. Okay? And then when they search, depending on the term that they type in, we even can guess at who they are, right? So for a sleep drug, you'll see that physicians are typing in something highly scientific, right? How that drug works. Versus a nurse is going to type in something related to dosage or how to administer. And versus the patient, they're going to type in something layman's, like a layman's term, like sleep drug. So based on the exact word that they type in, we even can tell who they are, and therefore can deliver to them the right bit of information that's written specifically for them. So this is what I call, user self-segmentation. The next example is selecting the optimal channel. So in this particular case, Mount Sinai was doing a lot of outreach in Harlem, for example, for high at-risk diabetes patients. And they were doing these in-person meetings where they were hoping to educate people. They were seeing, not enough people were showing up. So then they started to transition some of that stuff online so that they have online brochures, websites that people can access. But still, not enough people were coming in. As it turns out, the particular target population that they were going after, they don't even have computers at home. They don't want computers at home. They don't have broadband internet at home. Their connection to the internet is their smartphone, right, or is their tablet. So by realizing that, they now started deploying, SMS-based messaging, little tidbits of information that they can get out to people, reminding them of diet and good habits and things like that. So in this case, after realizing, that mobile was the primary and the first channel that these customers use, they now tailor the way they deliver the content. So talk about patient engagement, right? First, understanding how they access this information is going to allow you to more efficiently deliver the message to them. So in this case, they were able to optimize the channel that they chose. In the case of LifeScan, we see a company that used to distribute their blood glucose meters strictly through through pharmacies, now actually go direct to consumer. So there's going to be a theme of direct to consumer. So even though these companies that have historically distributed primarily through B2B channels are now having to go direct to consumer and better understand what are the occasions that they pick up these devices or that they need these devices and when they actually go in and pick it up. So they can either order through the website or reserve a unit and then go to the pharmacy and pick it up. So again, these are all new areas that are now enabled because the consumers themselves are connected all the time. And then again, keeping with the theme of direct to patient, these are some Google trends showing that more and more people are actually searching for these drugs, whether it's an OTC drug like Advil or an RX drug like Humira, right? They're now searching for more information online. So whereas most trend graphs tend, for Google search trend graphs tend to be drifting downward, these are actually drifting up. So this tells me that more and more people are looking for that kind of information. That includes patients, right? They want to look up the information about Humira, not just what the TV ad tells them, and not just what the print ad tells them. They're going to go online and do a lot more research themselves. Okay? And the concept of real-time crowdsourcing, so I'm just going to point out the middle one. So we talked about those fitness trackers and how people are quantifying their own fitness and their exercise activities. So if millions and millions of people are doing that, that's generating large quantities of data. And all of that will have a collective impact. So based on this chart, you'll see that behavioral patterns is one of the biggest influencers of actual health outcomes. So if you think about people now monitoring and tracking their own fitness, that's an example where that's going to help them modify their own behaviors so that they can lead more healthy lives. So that's just, literally, like I said before, this is just the very, very beginning. So there are many more opportunities to come where they're monitoring other things, not just their exercise activity, right? And those are going to lead to behavioral changes that are going to have a meaningful impact on outcomes as well. So all of this is now generating, enormous quantities of data. And this is just a nice visual published by GE Health to talk about the different disease states. And this is really to tie back to digital health records. So as more and more of this content gets digitized, then we can start to mine it for diagnoses and mine it for trends, right? And so these are going to give us insights. It's going to give the plans and payers insights about how to improve overall outcomes. And then two more quick examples from the physician side of things. So we all talk about iPad detailing or e-detailing. So now, in addition to just making those, content available through iPads, the other benefit is that as people are using this content, we now have analytics to see what they're actually using. So in the past, when you handed out a brochure, you didn't know if the doctor looked at it and also what parts of it were most meaningful and interesting to them. Now, when you're doing it through digital channels or through mobile devices like a tablet, you can actually look at what they're clicking on and what they're spending time on. So if you pair that with analytics, now you have much deeper insights about what content actually matters to them. Okay? And finally, enterprise sales. So I'm trying to give you a lot of wide examples, both from pharma and also not from pharma. So in the non-pharma case, you have Intel selling millions of dollars worth of server chips, right, to IT professionals. Those are long lead times, right? And if you think about these large medical machines from GE Healthcare, talk about long lead times. Those have an average of 18-year sales cycles, right? So what happens in the in-between time, right? So not every hospital is looking to buy the machine every day, right? So they're probably going to be researching. So consistent with the themes that we talked about earlier, whether it's a patient or a physician or a hospital or a payer, they're going to be spending a lot of time researching. And a lot of that's now going to happen through a mobile device as well. So what are the things that we as pharma companies need to do, or as marketers need to do, to ensure that they have the information that they're looking for so that we can inform their purchase, even though the purchase cycles are 18 years long or 5 years long, whatever it may be. So all that being said, we now need to kind of take a step back. Just like Patrick was saying earlier, a lot of people think about mobile as just the channel or as just the device. So hopefully what I've shown you in the last 40 minutes or so is a way to think about mobile as beyond that. So I typically talk about digital marketing as not just online marketing, but really as the insights that we can get from these digital channels, which now includes mobile, so that we can better tailor our marketing to both physicians and to patients. So in this case, it's really like, let's take a more holistic approach. Let's think about the entire ecosystem, which consists of patients and physicians and the payers and plans. So we've seen many examples where companies that used to just sell to hospitals, or companies that used to place their devices through B2B channels, now have to also take into account patients, the end user that they're serving, because of these changes and because of the changes of the habits and expectations of these users. And finally, let me just leave you with this thought: mobile is not just mobile. So in this case, this was a really great graphic that I found, which is basically, it should be different screens, right? Whether it's the laptop, the tablet, or the smartphone, it's the same, it's different windows, but windows in on the same content. So whether you're using a laptop or a smartphone or a tablet, most people are online researching things. So what are those fundamental changes in user behavior, both from the patient perspective and the physician perspective, that we now have to take into account? And keep in mind, those changes are irreversible. So just a quick recap, we first looked at fundamental technologies that are enabling these things. So whether it's internet, to adoption of the devices themselves, to mobile broadband, so you can actually get access to the information in your hand. To then the concept of mobile is more than just marketing, right? So understanding how people come online to look for information, and the fact that those actions that occur in digital channels give us new insights and allow us to really mine that data to get new insights about what patients and physicians are looking for. And all of that comes back to the theme of innovation. So we all realize we have to go quickly, right? Otherwise, the way some of those industries have been disrupted by technology, it's those kinds of things will happen to us. So innovation should actually be the concept of how do we make the processes, whether it's looking for information online or whether it's physicians streamlining their practices, how do we help users make those processes more efficient? If we can do that, then we can tie this all the way back to driving business impact for us. So enjoy the rest of the conference, and I look forward to learning from all of you as well. Thank you very much.
If you have any questions, just raise your hand. We can walk the mic to you. I think walking the mic would be awkward. Cool. Anyone want to start? I had a question.
Yeah.
In regards to, you mentioned search marketing. One of the things that you didn't touch on was display marketing. And for the campaigns that we run a lot of clinical trial recruitment for rare diseases and oncology. We find that there's better conversion rates on the display advertising than the search, because the search has become so crowded in the pharma space. I didn't know if you had any comments on that.
That's a great point. For rare diseases, people may not know what exactly to search for. So I think display, when you're putting something. So Patrick was talking about recruiting for clinical trials. For things that people are not aware of yet, display and display-like advertising would be highly efficient. And even in that case, digital is going to be extremely efficient, because if you think about printing that in a magazine or on a newspaper, what are the chances of someone actually opening up to that particular page in the magazine? And in the physical world, that's extremely costly to get the word out. Whereas whether it's display or search in digital channels, it's much more efficient. And especially if you're talking about putting display ads on Facebook, those are in the tens of cents range for CPMs. So you can get a huge amount of reach that way. So So that's a great point. Any other questions?
I also had a question, and you mentioned, I think pretty clearly in one slide about how patients aren't willing to pay for those apps. They're not willing to put out the money for some of those healthcare things. And then about 2 slides later, you had something that showed increased revenues in this area. So I come back to you and say, okay, who is going to pay for those services and that innovation?
I think the first slide talking about patients not willing to pay, that to me is just an indicator that we're very early in the game, right? We're in the early innings, so to speak. So a lot of things, just like cell phones themselves, right? In the early days, you had to give away the device for free and lock them into a contract. So, for leading edge adoption, that's how you can actually get more people to use it. So talking about the apps themselves, right now, if it's just a fitness app, they might want to just download it and try it out. So I think that's the requirement. But over time, all those revenue charts, the revenue has to come from somewhere. So I think it's going to be a combination of both the end user paying for parts of it, but also we as advertisers, as the pharma companies themselves, are paying to reach those patients and physicians. So part of that is going to be, just like the evolution of digital marketing, pharma as an industry is still a laggard compared to other industries in shifting budgets to digital. And part of that is due to regulatory environment and things like that. But pharma has a lot of room to catch up, let's just put it that way, right? So whether it's in the adoption of the technologies themselves or in shifting budgets to digital channels for greater efficiency, I think some of that's going to be accounted for in terms of the lift in revenue. Okay. Thank you.
Any other questions?
So I'm just curious about your experiences in terms of the cultural shift that's required. So it's not even a question of money being the biggest barrier, or the technology, or the patients being ready, or the doctors being ready. It's actually the cultural shift within pharma. And I've seen myself how difficult it is even to convince, my manager when I worked at GSK to say, okay, let's use a mobile device for this particular project.
Yeah. I think that is absolutely the case. So, the change of culture within the pharma companies, and even the change of organizational structure. So I can tell you, if a pharma company has a branding department, marketing department that's different from IT department, that's different from med legal department, because of those departmental silos, those perpetuate their lack of adoption, right? I've seen that. It's not just pharma, it's in other companies as well. The point is, digital and mobile don't fit neatly into any one of those traditional, company silos, if you will. So it's really about forming, these cross-functional teams to start to address this. And the companies that are able to do that, I've seen great examples across J&J, where they have, internal processes where they deliberately cross-pollinate on a monthly basis, or at least on a quarterly basis, so that the IT people are sharing knowledge, the marketing people are sharing knowledge, and the med legal department is always involved. So they can start to, collectively help push the envelope. So I think, cultural, that's a fundamental shift, and that's why it's taking such a long time. But, bottom line is, I think the market is going to drag the pharma companies kicking and screaming into these innovations because they have to. And the ones that are able to make that transition and do those innovations are going to be not only able to survive, but also create a competitive advantage for themselves. I mean, I've seen smaller biotech companies do way, way better and be a lot more efficient in their use of digital than big pharma. So I think that's going to be the model going forward. It's not these big behemoths with different departments. It's going to be smaller, more nimble teams that are able to do that more quickly. But that's a great observation. Thank you.
Just as a follow-up question, if you were to build a pharma company from scratch today, what is the single most important thing that you would do to enable not just for mobile to be integrated, but whatever technologies are coming in the future that are going to impact patient engagement?
I would say just have great processes. Not all of this can be addressed by hiring, one person or another. I mean, a lot of this requires cross-functional knowledge. some people who are knowledgeable about digital marketing, some people who are knowledgeable about the devices on which you market. But it's more important, just like, from the J&J perspective, what they've done is now they've set up teams and they've set up processes where there's not only training, but also deliberate cross-pollination. So I think, what any pharma company should do is just have those kind of things where different people from different teams are constantly sharing ideas. And I think that's going to facilitate the process of innovation better than anything else. Great, thank you. All right, enjoy the rest of your conference. Yes, okay, one more.
Just wanted to ask a quick question related to regulation and how you see the future of that going as far as any kind of flexibility or better communication of how the future of that's going to be.
So let me put it this way. So this is coming from having tried to pull pharma clients into the digital space for 3 years when I was at Omnicom. Bottom line is regulations are not going to change that rapidly, if at all. Okay, so just assume that those are there. But if you think about digital and mobile as just a way to push more marketing messages out, then you're probably going to be restricted or handcuffed by those, right? Because again, there's not a lot of clarity from the FDA about what you can do in social media, what you can do in search. But if you think about that slide where I had the different search volumes for the different terms, what you can do today and use a lot of the data that's free and it's available is really gather the insights based on what people are already doing online. So talk about social media monitoring, talk about mining search data to get better insights about what patients are looking for, what physicians are looking for. It's more the theme of optimization. Okay, so it's not doing anything newfangled or new that hasn't been approved and all that kind of stuff. If you just study what patients are looking for and then optimize the words you use in your content, I'm just trying to be very concrete about that. If you're able to use anti-cancer instead of the word anti-tumor in your content, more of those people looking for that will actually be able to find your content. So in that case, you're not doing anything newfangled, right? It's all within the compliance envelope, but you're still able to achieve a greater business impact and be more efficient about it. So in that case, there's so much you can do in digital and social that don't require you to push the envelope of regulatory. So just assume that regulatory considerations are never going to go away and it's not going to change very quickly. There's still a lot that can be done immediately that better leverages what we have in digital, social, and mobile. Great. Thank you very much.
That was terrific, and I think it gets us thinking about this meeting today and just start the wheels turning as we go through.